This WBT is part of a series of UK Healthcare IT Education online Sunrise Clinical Manager training. This module covers order reconciliation and the discharge process. The Order Reconciliation Manager can be accessed through its icon in the main toolbar. It allows users to reconcile orders and review prior reconciliations for the current visit. Order reconciliation is a part of the admission, transfer, and discharge processes. Reconciling the patient's home medications is the last step in the admission workflow. Select Admission. Here you will continue or stop the medications that the patient takes at home. You may also place new medication orders at this time. When you mouse over an entry, a drop-down arrow appears. Click on it to see your options. All medications taken by patients while under our care are dispersed from our pharmacy. Home medications may be continued with an equivalent while here, taken under review, or stopped. Continue will offer you common choices and open the order worksheet for you. Start at the top. Information entered into the indicated fields will carry forward to all the orders selected on the form. Select the appropriate order. Note that the administration details displayed may be changed by clicking in the fields. Click OK. Reconcile all remaining home medications. When all meds are reconciled, save as incomplete. Note that only transfer or discharge reconciliations are to be saved as complete, effectively closing the Order Reconciliation Manager. Pharmacy will verify all meds and complete the admission reconciliation. When a patient is transferred, orders on their chart must be reconciled. This is the last step in the transfer workflow. Select Transfer New, Transfer. The Order Reconciliation Manager displays all orders to be reconciled. Please note that all heparin and radiology orders are automatically discontinued when the transfer order is placed. To continue those orders after the transfer, the provider must re-enter them. Click on Multi-Order Reconciliation. Select Discontinue Cancel. All the active orders are displayed. The status of certain orders automatically switches to Hold. Check all the orders that should be stopped. Click OK. Do not click Apply. To finish the transfer reconciliation, click on Mark All Remaining as Continued on Transfer. The transferred orders will move to the window on the right. Transfer reconciliations are always saved as complete. Enter your password and click OK. Now we will walk through discharging a patient. The Discharge tab consolidates all aspects of the discharge process. It populates and opens the discharge summary note for editing and attestation and opens the discharge patient order. Acronym expansion and Smart Paste, F6, work in any of the free text boxes. The anticipated discharge date that was entered in the admission order populates on the Discharge tab. You can update the expected discharge date by clicking on the Change button. The table of contents is located on the left-hand side of your screen. Selecting an item will navigate you to that section. The flow is designed to work straight down the table of contents. Many fields pull information from the patient's chart. Others are manually updated. At the bottom of each section are buttons for the previous and next sections, as well as one labeled Mark Complete. Selecting Mark Complete will trigger a green check mark to appear by that section and automatically jump you to the next section. The button will change to say Mark Incomplete. If you need to make changes, return to that section, click Mark Incomplete, update the information, and then mark the section as complete again. Diagnoses will populate from the problem list. You can enter new or remove current problems here. Hospital course and surgeries and procedures are pulled from the Snapshot tab by clicking the Copy Snapshot buttons. Discharge order reconciliation is initiated via the button in the Discharge tab. The medication list will update in the tab. Select Discharge, Discharge New. Home medications that were continued during the patient's stay are grouped together. Click the button to continue them after discharge. Inpatient meds may be continued at home through the prescription writer. Set the dosing and administration details. Add instructions to the label and save. The new med shows in the Home Medication section and on the Discharge tab. Then DC all remaining orders. Save as complete when done. This will open the prescription writer. The Submit method defaults to e-prescribe, but can be changed to print if necessary. The patient's preferred pharmacy will be displayed, but can be changed with the drop-down. Prescription writer is connected to SureScripts, and any pharmacy in the United States can be selected. Double-click the pharmacy to add it to the patient's preferred list and select it for this order. Then click Close. Select your location from the drop-down list. Select the provider and click OK. Enter your password to complete the process. Order reconciliation is complete. Click to add common instructions to the note and you may enter additional instructions in the box. Mark the section as complete and move on to the next. The discharge disposition is selected from a drop-down. With qualifier options. Indicating if there are results pending is required. Specify what has not yet been resulted. Mark the section as complete and move on to the next. Selecting some activity restrictions will open areas for additional documentation. Scroll down for more categories. Mark this section as complete and move on to the next. Enter the physician to follow up with or tests to be done, as well as additional information here. When done, mark the section as complete. The Appointment Scheduler section is for others to complete. The Service-Specific section is next. Information and instructions for specific services is documented here. Skip this section if nothing here is needed for this patient. Clicking the Discharge Patient button opens the Discharge Summary note. Required fields are indicated in the Sections tab. Use the table of contents to find and fill in missing information. Save as final when done. The Discharge Patient order opens automatically. Ordering service is required. Fill in the attending's name and pager if necessary. There are two sections. Use the bottom section to indicate any tests or procedures required before discharge. Note that orders cannot be entered from this screen. Enter them as usual. Selecting either something in this section or nothing further required is mandatory. This completes your part in the discharge process. A unit clerk or RN will enter the final discharge order after the patient has left the floor. The patient's chart for this visit will remain on your personal lists until you remove it. This training has been brought to you by UK Healthcare IT Education. Thanks for watching. Our service desk is open 24/7. Call 323-8586 anytime. For more training resources, click on the IT Education Resources button on CareWeb or search for us on the Internet.